Developed by the British for defensive purposes in 1903, Kakamega is located in the former western province of Kenya, nearly 30 kilometers north of the equator. With a population of almost 2 million inhabitants, it is Kenya's second most populous county and is considered the heart of Luhyaland. Despite efforts made by the county government to improve healthcare accessibility, health inequalities continue to create a divide between those who have access to quality care and the underserved. The lack of medication, health insurance, and inadequate healthcare infrastructure are some of the issues that plague this society.
Tunapata shida sana kwa sababu unaweza enda ushide kwa laini, kama ni unaenda Serivaro unashida kwa laini. Okay. Utakutana na daktari, matibabu huko iko sawa, but the problem is ukishafika kwa pharmacy unapata maybe you spend the whole day unapata paracetamol ama Piritons. So dawa zingine zote unaambia utoke nje ukanunue, na maybe hukuwa na chochote kwa mfuko. Unapata dawa zenye utapata ni dawa zenye ni cheapest, maybe 20 bob, 10 bob, 30 bob. Dawa yenye imepitisha more than 150, 300, 1k unatumwa nje.
Poverty exerts a profound and far-reaching impact on healthcare accessibility, creating a vicious cycle where economic hardship and health disparities reinforce each other.
The challenge I have is medical bills. Like you can see, I don't have gainful employment now, and I used to have a NHIF card, but because of difficulties in life, I cannot be able to pay for it, so it is dormant. Hiyo ndio challenge kubwa ile niko nayo saa hii.
Since poor families struggle to meet basic needs like food, shelter, and clothing, foregoing necessary medical care due to financial constraints is inevitable.
Thousands and thousands of people are suffering, and they have no money to pay for medical bills. I'm telling you, I know quite a lot. People can't access medical help. People cannot access good food. People cannot access clean water. The situation is bad, my bro.
The free medical camp leveraged technology to offer services such as NCD, tuberculosis, dental, eye and cervical cancer screenings to ensure patients receive treatment and medical care that they desperately need.
We are here in partnership with the county. As we know, health is devolved. So the county is leading. We are partnering to ensure that we have as many people as possible access healthcare. We are not doing this alone. In addition, with the county, we are partnering with Zuri Health, who are critical as a partner. And why Mpesa partnered with Zuri is because of technology. We know with technology you can achieve efficiency and you can achieve a scale. And the registration is, we are doing registration using a technology. We have a platform where all patients as they come in, they are registered. And based on the condition, then there'll be intentional follow-up from our doctors or from the patient side to ensure that they continue getting support.
Matibabu haya ya Zuri Health na Mpesa Foundation ni ya bure. So hakuna mtu ambaye anakuja kuitisha malipo hapa katika medical camp hapa approved school. So matibabu yote, iwe ni cancer screening and treatment, iwe ni eye care, iwe ni HIV and AIDS, everything is free.
Malaria remains a major public health concern around the world, with tropical and subtropical regions bearing the greatest burden despite upscaling of control strategies. Although Kakamega is a landlocked county, the area has a tropical climate with average temperatures ranging from 19 to 27 degrees Celsius, making it suitable for malaria transmission. Here, access to healthcare is a luxury for many, and the specter of malaria casts a long shadow over daily life. To reduce the overall disease burden and incidence, malaria vaccines were offered to children from the age of 5 months. With a 4% prevalence rate, Kakamega County has over 47,000 people living with HIV. Regardless of the measures deployed by the county government to manage HIV and AIDS, the disease still remains a major challenge.
Okay, currently, tunaweza sema iko not that high, but then we are being it's being controlled because we are doing much of testing, especially from mother to child transmission, ANC, that is antenatal care, so and maternity. So hiyo side ndio mostly we get a challenge because mama anapea mtoto virusi, but currently we are doing 100% testing. So when it comes to general population, mostly sahi kama hapa tuna support tu ile tuna test, tunapeana information especially for PrEP, general population, zile dawa nye zinafanya at least wewe usipate virusi from the camp. Now there's no stigma mtu akikuja kupima. People have come. For personally nimepima watu wengi na nimepeana information na we are grateful because tumeidentify pia kwa ule nye amepatikana nayo, tumeidentify na tumemrefer ili aende ashughulikiwe hospitalini. Yeah.
As the county grapples with the insidious shadow of gender-based violence, the vulnerable populations remain at risk of being infected.
Yeah, recently we have seen gender-based violence, it's something so high, especially in the minors. Na hii wakati ni watoto wamefunga. Currently we are experiencing high numbers when it comes to gender-based violence, defilement cases. But we are there to support, especially when it comes to counseling, we are there to support.
Adolescent pregnancies are a global issue, but most often occur in poorer and marginalized communities. According to the statistics by the Kenya Health Information System, teenage pregnancies in Kakamega County stood at 12,057 in 2022. The heart-wrenching rate of GBV cases in the county means that girls are more likely to drop out of school and face a higher risk of unwanted pregnancies and sexually transmitted infections.
You know, teen pregnancy comes with cancer, cervical cancer. It comes with STDs. It comes with HIV and AIDS, na magonjwa mengine. But at the same time, I know Mpesa Foundation. I know the programs we have done, and I'm also requesting if you can help me do something about teen pregnancy, because we have high numbers of teen pregnancy in Kakamega County. As at now, we have 13,000. If you can help me bring down the numbers, especially in terms of menstrual hygiene, we will really appreciate as a county.
While drastic measures are imperative to curb gender-based violence, implementing evidence-based teen pregnancy prevention programs, expanding access to family planning services, and utilizing mass media campaigns to promote safer sex may reduce teen pregnancy and improve outcomes for the youth. The camp offered reproductive health services to women and men, including family planning and sexual health education.
The Mpesa Foundation mainly deals with family planning amongst women of a reproductive age. And when we talk about family planning, it's not only women of a reproductive age, there are also men who are involved in family planning. And one thing we've noticed with the Kakamega camp, we've seen men who are strong enough or courageous enough to come have themselves know more details about its family planning. And the main thing we were giving the men who were here were condoms, and they were bold enough to ask for them. We also had other women of a reproductive age from the age of 18 to as maximum of 45 who had IDs, and we were able to give family planning to them. And the kind of family planning methods we were issuing, we had the pills, contraceptive pills, we had the Jadel. The Bear project in Precise is really looking forward to having over 30 million women given family planning all over Kenya, and we're really looking forward to do that in all the other camps coming. And we're glad to inform that Kakamega had quite a good turnout for both sexes, both the males and the females, and we're really happy about it, and we look forward to doing more projects in the other camps that will be coming.
At the heart of the camp lies a team of dedicated dental professionals and volunteers armed with compassion and expertise. With portable dental instruments, they transform this outdoor space into a haven of oral health. More than 200 patients receive dental screening, with 24% of them benefiting from the vital procedure of minor dental extractions. The inhabitants also received the gift of sight. Skilled professionals from Lion Sight First Eye hospitals and dedicated volunteers offered free eye checkups to over 700 patients and distributed prescription glasses to those in need.
I've been to the eye doctor and he has seen me and he has given me his advice and he has given me drugs to go and use at home.
Non-communicable diseases heavily burden underserved communities. According to WHO, 86% of NCD deaths are estimated to occur in low and middle-income countries. The camp provided screening of blood sugar levels and blood pressure to identify potential risk factors for NCDs. From the screened attendees, 31% were identified as hypertensive, 3% diabetic, and 10% suffered from osteoarthritis.
Hali ya kansa katika Kakamega County iko hali ya juu, na mimi kama first lady nimesaidiwa na Mpesa Foundation na Africa Cancer Foundation plus USAID Boresha Jamii. Tumejaribu kufanya matibabu screening and treatment ya cancer, especially cervical cancer and prostate cancer among cervical cancer and breast cancer among women, and prostate cancer and breast cancer among men, and HPV vaccination. But bado hatujapata ile 100% screening or treatment. So bado tunaendelea nayo, but our challenge mostly is resources to do the screening. Na hapa nashukuru because even hapa tunapeana HPV vaccination, na ningependa kuwaomba wazazi walete watoto wapewe hiyo HPV vaccination because itawasaidia kuzuia ugonjwa wa cancer.
Over 100 women were screened for both cervical and breast cancer, and serious cases referred for immediate attention. Medication to manage the NCDs are offered for free at the health camp pharmacies. Moreover, some of the NCD patients received a one-year NHIF medical cover to ensure that they receive continuity of care even after the health camp.
To ensure there is continuity, we are also providing NHIF cover for patients to ensure that they can go to the nearest county facility to get services.
Though we didn't get my drugs here, they have paid for my NHIF and recommended that I visit a public hospital for the purposes of getting a dosage of my drugs.
So it's not a one-day event. There is follow-up to ensure people's health is restored.
Blood is a critical resource for medical treatments, surgeries, and emergencies. The camp not only educated the attendees on the importance of blood donation, but also set up a station where volunteers can donate blood to increase blood supply at the Kakamega County Referral Hospital. The 23 units of blood collected will help maintain an adequate supply to meet the needs of patients. Despite the many healthcare services provided, pressing health concerns still emerge.
Akina mama wengi wana shida ya fistula na mara nyingi hawaongei. Unajua mtu suffering in silence because unajua ni kitu cha aibu. So ningependa Zuri Health pamoja na Mpesa Foundation ikiwa mtaweza kutusaidia kwa hilo in future, tutashukuru sana. But as at now, we are really appreciate the support you have given us and your partnership.
As Mpesa Foundation, since 2015, we have been implementing a fistula program. In fact, we call it Restoring the Dignity of Women and Girls in Kenya. And every quarter, Mpesa Foundation, in partnership with Flying Doctors Society and the county hospitals, we conduct fistula surgeries. We'll sit down and we'll explore the possibilities because partnership is critical for us. And I can tell you, fistula is more stigmatizing than most of the conditions that we know. Because women cannot go to church. They cannot go to their social groups. They cannot go to chama. They cannot go to the market. They're even discriminated and stigmatized by those close to them. So seeing a 45 minutes procedure restore the dignity of this mother and she goes home smiling. What else do we need to do? That is what really warms our heart.
As the day draws to a close, the impact of the free health camp becomes evident. For the inhabitants, the provision of free screening, medication, awareness, and medical covers reignites the hope of a healthier tomorrow. The camp has not only provided healthcare, but sown the seeds of empowerment.
I would like to say thank you very much for Safaricom Foundation for what they are doing to people like me who cannot be able to afford affordable health care. They should be doing this almost in every other county, so that there are some who could not be able to come here, but me, I managed to. There are others who wanted to come, but could not manage to. So if they could bring it nearer to everyone, then we'll say thank you. Yes.